Welcome to Derm-It Trotter, Don't Swear About Skincare, where host Dr. Shannon C. Trotter, a board-certified dermatologist, sits down with fellow dermatologists and skincare experts to separate fact from fiction and simplify skincare. Let's get started.
Welcome to the Derm-It Trotter Don't Swear About Skincare podcast. Today, we're going to dive in a little deeper into getting those medications that your doctor really wants for you. You know, the pesky ones that are hard to get and require a pretty lengthy process. And I've got an expert here today to really talk more about how do we get that done for our patient. Janelle Ball is here with us. She's a renowned speaker, consultant, and the CEO and founder of BC Educators, a company specializing in helping medical offices and patients access specialty medications. She's also the host of a popular podcast that's Derm Good, where she dives into the world of access, affordability, and advocacy in dermatology. So I'd like to welcome Janelle Ball here to the podcast. It's great to have you here, Janelle.
Thank you. It's so great to be here. I appreciate you having me on.
Of course, this is an area that, you know, from dermatologists like myself to other medical specialties, and for all of you out there, you may have struggled with this where you're like, hey, my doctor wants me to get this medication, and it's not really something I can just go to the local pharmacy and get. And so I think this topic is going to really help kind of outline that process, what the challenges are, and really what it entails, so everyone just has a better understanding. So one of the things I think people want to know, you know, just in general, what is a specialty medication? Like, what does that even mean?
Yeah. So, a specialty medication is the way that insurance kind of classifies these medications that are like biologics, which are injectable medications. But they're specialty because the process for getting them is a little bit more difficult. You have to go through a prior authorization and get the approval through the insurance. But then not only that, you also have to go through a specific pharmacy to get this medication filled. Because the biologics, a lot of times they are shipped to you on ice because they have to be refrigerated. So generally, that's not something that you can go pick up from your local pharmacy because they don't really keep them in stock and they're very, very expensive. So, the insurance companies, they want to make sure that you're actually going to get something that you really need. And so they kind of have you go through this prior authorization process so that you can get the medication and that they want to make sure that you're going to be able to stay on the medication, especially if they're spending so much money for this medication.
So you mentioned in there this specialty pharmacy. So again, like you said, not like you're just walk down the street, local pharmacy type thing. And you mentioned because that packaging, that's the main reason. So can you pick a specialty pharmacy, or is this something your insurance, decides for you, or do you have some freedom in that?
A lot of times the insurance does decide that for you. There's two different types of specialty pharmacies. You have your mandated specialty pharmacy, which is kind of the pharmacy that your insurance is telling you. So you've got this pharmacy benefit manager who does the prior authorizations. And they're usually the ones you take that card to your local pharmacy when you're getting a prescription filled. So they're the ones who are managing those prior authorizations. Well, if it's a specialty medication, then there's a different type of prior authorization that you have to do. And so they also require that you will utilize their specialty pharmacy. So we'll say CVS Caremark, for instance. Usually the prior authorization goes through CVS Caremark, but not those local CVS pharmacies. It's CVS Specialty Pharmacy is where you would have to fill. So they typically will reach out to you to set up that shipment for your medication. But then there's also other specialty pharmacies they do a little bit extra. They sometimes can help the office with those prior authorizations, and sometimes they'll help do some outreach to patients to maybe get them set up on a copay card or something like that. But it most of the time they're not really able to fill. A lot of times they can fill maybe one time and then their insurance is saying, nope, okay, you filled it once. Now you actually have to fill it through our pharmacy. So a lot of times, most plans, it just kind of depends on the insurance plan itself. And I think that's something that we usually will find out after we do that prior authorization, if it's actually mandated to go to a specific pharmacy.
So a couple key things I want to highlight that you just talked about. One, you mentioned that pharmacy benefits manager, the PBMs, as we talk about them a lot. I think for patients, they're kind of cool. What the heck is that? So one, I'm going to have you probably dive into that a little bit deeper, and then I want to talk more about that prior authorization process. So can you explain exactly what a PBM really means, just kind of to the average person?
Yeah, so the pharmacy benefit manager, the PBM, what they do is really just kind of make sure that this is the right medication for the patient. So you go into the doctor's office, you get prescribed a medication, say you're being treated for psoriasis. And, what the insurance is looking for is to see, okay, what other medications have they been on in the past and why do they need this medication? So we have to have that justification. And so, when it comes to doing the prior authorization, that's where it's so important as a patient to make sure that we are giving our doctor as much detail and information as possible, because that really helps us with the prior authorization process. But that pharmacy benefit manager is really just kind of checking doing those checks and balances. And they want to make sure that whatever the doctor is prescribing is is actually beneficial for the patient, and maybe they don't have any other medications that might be contraindicated with those medications that they're currently on. So it's really just a lot of the checks and balances in their way of making sure that, is it safe? Is it, a medication that is being written for what it's actually indicated for. So we're not using it, for something that it really shouldn't be treated for, which would be not on formulary or something like that. So they want to make sure that it's on formulary, that it's, something that they can actually get and that the patient's actually going to stay on that medication. So the pharmacy benefit manager kind of does all of those checks and balances. And, when we're submitting those prior authorizations, they're reviewing that information and they're making sure that we're answering those questions, that there's requirements for some of these medications for labs, so they're going to check to make sure that the patient get those labs. Are they being compliant? So they're really checking to see if, does the patient want to continue this medication? Is it working for them if they're on that therapy already? So they're going to check all of that. And, when it comes to, it's just really managing the medication for the patient to make sure that it's a great fit, that they're not just spending a bunch of money, and the patient's not going to continue this medication.
And just to kind of clarify, that pharmacy benefit manager, is that something that the insurance company picks for the patient, or do you have any control over who that really is for you? Just so people can understand who's sort of helping them in making those decisions regarding their medication.
Yeah, it's typically the insurance company is choosing that. They have these contracts. So, your big groups like your United Healthcare, they usually are partnered with a pharmacy benefit manager, which is called Optum RX. So, Optum, they're the ones who are going to manage those prior authorizations and those prescriptions. And then they also have their pharmacy where you're going to have to fill. So, there's other carve out plans. It just really depends on the insurance plan, but that really isn't something that you get to choose who you want to, what pharmacy benefit manager I want to use. But here's the thing. I think it's really important for patients to know that you got to use your voice. You got to ask those questions to find out what is the best option for you when it comes to searching for a new insurance plan, or just even understanding what plan that you have currently. So it's really important to just ask a lot of those questions, especially if you have been prescribed a specialty medication.
And we mentioned too the pharmacy benefit manager or the PBM, we talk about those, from the standpoint of how they decide on, what requirements. You mentioned maybe lab work, or, if you're maybe using the medicine, if you're compliant with it. Does that vary per individual PBM, or do they have some uniformity in what they tend to ask?
Typically, it's based on the actual drug itself. So if you go and Google a specific drug, a lot of times they'll have the packet insert. So it'll tell you about, what the drug is, what's in it, what it's indicated for, what you have to, what you're treating. But then also it'll have some requirements in there that will say, you have to do a TB test before starting this medication, or you have to have, XYZ, these different labs before starting this medication. Or if you're also on another immunosuppressant, you cannot take this medication. So a lot of times those guidelines do come from that.
Mhm.
And that's kind of what the insurance companies are looking at. But a lot of, there's a lot of similar medications out there as well. So I think sometimes they kind of add those in and then just kind of piles that on information in there, and uses it kind of a standard process for a lot of the medications.
And of course, kind of along the lines that with getting that, investigation done and looking at the benefits piece, it's this whole concept of what we've been talking about a little bit, prior authorization. For some of our listeners, they may not even really know what that means. Maybe they just were prescribed a medication now for psoriasis or their eczema, and they're learning about this process. Can you kind of explain just in general terms, what is a prior authorization?
Yeah, a prior authorization is really just the insurance's way of knowing that you need this medication. So they're going to ask a series of questions. So when we send that prescription into the pharmacy, a lot of times what ends up happening is they're going to say, okay, we need this authorized by the insurance before we can actually fill this medication. And so what they're going to do is send us a form, and those questions that will be on there is, what is the medication? What are we using it to treat? So if it's for psoriasis, where is that psoriasis located? What other medications has this patient been on in the past? And why didn't those other medications work? So, for me as, a biologic coordinator, I've been working and doing these prior authorizations for so long. It's really important to get those questions, answered before we even go to the prior authorization process. And that's where it's really important, as a patient, to make sure that, when you're going to the doctor's office, you let them know exactly what you've been on in the past. And, I'm so bad at that myself. It's just something that happens when you don't really think like, oh, I was on this other medication years ago and it didn't work, but I don't remember what it was. And that's usually how
Exactly.
it works. But it's so important, and it's funny because I talked to my sister-in-law. My nephew has a really bad eczema, and so I before she would take him into this doctor's appointment, I'm like, hey, just get a list of everything that you've used on him. Make sure you write it down and take notes. And that way you can get your questions answered and you can tell the doctor, because we need to know everything that you've been on in the past. Because if there is some reason that you might be on a blood pressure medication that may not work well with the medication that you're being prescribed, we want to make sure that we have all of the information and all of those details, because when it comes to the prior authorization process, it's going to make a huge difference. And if insurance doesn't see that, okay, well, clearly they can't be on this medication that we're telling them that, is a step therapy, then, we can move on to the next best thing. So, there's just a lot of questions that they're going to answer. But I think the most important thing is really just getting a good detailed history of the patient and making sure that we have as much information as possible. A lot of times, when you have psoriasis, you don't really think about joint pain and psoriatic arthritis.
Mhm.
So those are one of the questions that a lot of the time the nurses and the MAs will ask, but patients don't always offer that information up. So it's important to be able to speak up and say, okay, I've tried and failed these other medications. I always suggest, call your local pharmacy and get a list of those medications that you were on in the past. That way you don't have to remember because they've got that whole
Exactly.
list already for you. So grab that list and bring it in with you to the doctor, and make sure that you're able to give them as much detail and information as possible, because then it makes that prior authorization process a little bit easier. So, I always like to make sure that I'm prepared before I start that prior authorization, and just know that, sometimes there are denials, but it's not the end of the road. And, when it's approved, then that's great. But it's coming back to the doctor and making sure that we're doing those follow-ups, because, again, that pharmacy benefit manager, they're managing that whole prescription process. They're managing, how long you're going to be on this therapy. And if you're going to get asked for a renewal, these prior authorizations, they usually last for a year. Sometimes at the beginning, it could be 3 months or 6 months. And then they just want to see if you're doing good on that medication. And if we're going to continue paying for this medication, then we need to see that you're doing good and that it's working. So they're managing all of that. So that's what that prior authorization is going to include in there.
Well, I think we don't make it any easier. We name these drugs, such complicated names. If they're not catchy enough, you're not going to remember what you're on. So
I
yeah, it
know.
makes it tough for patients. So, kind of what I want to go through here, in the last like 5 minutes or so we have is just talking about, what's the process, from a little summary beginning to end. Like I write the script today. I have, Mrs. Smith in my office and she comes in and she's like, I've got terrible psoriasis. I'm like, great. We're going to get this better. I'm going to write this medication for you. As soon as I send that off, how would you explain or recommend to me as a dermatologist, how do you explain to her what the next steps are in general terms? Because this will help my colleagues that are newer. Some of them out in training haven't done a lot of these medications, and just making sure we're touching on that process. And also, I think to make sure the patient, we're on the same page, because it's all about communication with getting these drugs, because there can be a lot of sources of frustration, especially with access. So how would you describe kind of that summary of the process?
Yeah. So number one is definitely knowing what that process looks like first, figuring out, okay, I've got a coordinator that's going to manage this. It makes it really difficult when you have multiple people kind of hands in the pot because not everybody is an expert at it. So you want to have somebody that is very familiar with the payer landscape, that is familiar with um, all of the different medications that are coming out. I mean, there's new drugs that get approved on a regular basis. So, I really try hard to learn about those medications and what their process is for getting patient access. So as soon as that prescription is written, then I'm getting that enrollment form. So the patient's going to sign most of the time, and the doctor is going to sign, or the NP or PA. They're going to sign that enrollment form and then they'll send that over to me. So what I typically will do is I look for the insurance card and the pharmacy benefit card, because sometimes it could be two separate ones. I'm looking for that RX bin, PCN, and group information that's on that pharmacy benefit card. And that's what I'll use to look for that prior authorization. So I typically will go directly to CoverMyMeds to do that prior authorization. So I can fill that out. Um, I usually will look through the patient chart notes. So that most recent note is the most important, because insurance companies, they really don't like sifting through a bunch of chart notes. So if it's the most recent note and that is the most up-to-date information that has the patient's full history of what they've been on in the past, why they need to be on this medication, some scoring tools, like how severe is their psoriasis, what are the areas located, how does it affect their quality of life? That's another huge one that I don't see a whole lot of. But the quality of life question is really becoming more and more important. And I think insurance companies are really asking more about that. So the quality of life, and then really just that clear history of what they've been on in the past, what has not worked. So getting all of that information, and then I'm able to fill out that prior authorization. And so once I get that approval, then it's going to go through another process. Unfortunately, it gets sent over to the specialty pharmacy, and then they kind of do their verification to make sure it's approved and all of that, and then that they can fill. What I do is I communicate with the patient throughout the process. So I start that prior authorization, and then once I get an approval or if I get a denial, I'll reach out to the patient and let them know, okay, these are the next steps. We got this approved. So now we're going to have a copay card. If they have a commercial insurance, they're pretty much going to get on whatever medication we want. Most of these medications have a copay card or a bridge program that's available. So as long as you have a commercial insurance, most likely you can get on whatever medication. If it is a Medicare or a government funded plan, that can be a little bit tricky. If it's approved, then we might have to go to a prior authorization, like a patient assistance program. And there's probably a whole nother podcast episode about that.
Exactly.
But going through that, so really just keeping the patient informed throughout the whole entire process is the number one key, because then you can eliminate a lot of those calls coming back as to what's happening, where are we at in the process, and where's my medication. I left the office 3 days ago and I haven't gotten anything yet. So sometimes it can take 7 to 10 days to actually get that medication. So I'm really just keeping them informed throughout the whole process. If they have a commercial insurance and I can get them set up with a copay card, then I'm going to call the patient and get them that information. All these manufacturers for these companies, they have support. They have, their hub services where they can reach out to patients. So I always utilize them because that's additional education and resources that are so valuable for patients that can really help guide them and make sure that their questions are answered, or if there's a copay card issue, then they can get that question answered as well and get it resolved. Because the goal is get them on this medication and get them approved, but also make sure that it's affordable. Make sure that they can usually, pay for their medication that they want to get, and that it's not going to be an astronomical cost. So if it is a commercial insurance, most of the time they're paying a $0 or a $5 copay with those savings cards. So really getting them set up with that, and then making sure that once they do receive it, then they're either coming back into the office for an injection training or some kind of support, and just helping them understand that, okay, now that you've gotten started, we need to make sure that you're coming back in a 3 month or 6 months or every 12 months to make sure that you're doing well, that we can document that so that we can continue this therapy. So especially, if they're doing great on a medication and, their skin is clear or whatever, they're seeing really good results. The last thing we want is for the insurance to deny that second reauthorization. So it's really, really important to have them come back in and schedule that follow-up before they even leave. We need to see you back in 3 months. So we're going to reschedule this 3-month follow-up, maybe 3.5 weeks, just to be on the safe side. So we know that you've got your medication. But for the most part, as a dedicated coordinator, you've got all of that set up, and that patient should be able to get on that medication within, that 7 to 10 day time frame.
Yeah, I think it's great. And what you highlight too, I think the process like you just went through, it can be daunting, like just the summary, people listening are probably like, oh my gosh. But I think in the end, what you and I both know, it's so worth it, the value it brings to
Yes.
patients. And you're right, we have many other things we could dive in that would be a whole nother podcast. We'll definitely have to have you back on to talk more about those. But I want to thank you for coming on, just giving this kind of nice overview of specialty pharmacies and that process, because it is scary for a lot of patients out there. I know some of you listening have gone through it, and even for us prescribing, it's very frightening too. So just to know there's people out there making the process easier, so access becomes much more mainstream. And I think you definitely are doing that. For our listeners, if they want to find you, Janelle, where can they locate you on social media or online?
Yeah, so I do have a podcast as well. It's called That's Derm Good, and you can find that on any platforms, wherever you listen to your podcast. So Apple, Spotify, any of those platforms. But I'm on LinkedIn. You can find me on there, Janelle Ball on LinkedIn, and yeah, that's pretty much it. I
Great. Check out
um
her podcast, guys. It is
yeah.
awesome. And I really think for those that are overwhelmed, whether you're a patient or a professional trying to figure out this process, it really helps make it
Mhm.
simpler than what you think, so you really can get the medications that your patients need. So stay tuned for the next episode of Derm-It Trotter, Don't Swear About Skincare.
Thank you.
Thanks for listening to Derm-It Trotter. For more about skincare, visit dermittrotter.com. Don't forget to subscribe, leave a review, and share this podcast with anyone who needs a little skincare sanity. Until next time, stay skin smart.